My name's Yasmin and I'm in my second year of the MSc Nursing programme at UEA. So I was studying my first degree and I got halfway through that and I realised I didn't want to pursue a career in that. So I decided that after some thinking, that I wanted to work in healthcare, but I didn't know anything about healthcare. So what I did is I got a job as a healthcare assistant or an HCA at my local hospital and another one of my local hospitals as well. So I was working on the bank at both hospitals and I did that for 3 years and I was sort of looking to move up and to sort of better myself, and nursing seemed to be the logical answer to that. So I'd have to say my first placement experience, which was on a cardiology ward, was absolutely fantastic. Norwich itself is a real base for cardiology care, and there's a whole programme in place for that, which is really useful for patients as well as staff. It means there's lots of they've been constantly updating treatments and patient care, which is really invaluable for a student like myself and everybody else. So that was amazing. Experiences on the ward were really positive as well. They were very receptive to students and our needs. They were constantly asking us questions and it made us feel like we could ask questions ourselves, and that really informed our learning. It was just amazing, really. So the thing I'm most proud of for this whole course, I think, is for me personally, is for making it this far. The MSc is a challenging course, there's no denying that. You're packing 3 years of learning into 2. So the fact that I've got this far and I'm now in my final year is pretty amazing, pretty special. And I'm very proud of everything that I've achieved so far, both in practice and theory and in all my assignments and so on. I can't believe, hopefully this time next year I'll be a qualified nurse. It's pretty amazing, really. There's so many. Before I started this course, I didn't realise how varied the nursing profession was, but there's just so many, and on top of it all, the nursing profession is so well respected and will always be sought after. There will always be jobs for nurses, but you can work in both hospital and the community. all the different departments that you can think of, you could work there, both as a staff nurse, as a ward sister, as a specialist nurse, as a matron, as a community matron. Even as a nurse consultant. I know my local hospital has 2 nurse consultants there now, which is a really valuable thing to have, and it's just absolutely amazing that we have these opportunities available. It is daunting working in the NHS in healthcare as a rule, but I would say it is definitely worth it in the end. At the end of the day, you are helping patients, you are helping people, and in my book, for me personally, there is no higher call than that, and I just think it's fantastic.